Hi, Dr. Watson.
Hey, Bridget, how are you?
Good, good. How are you?
I'm good. What brings you in today?
Well, my migraines. My medication doesn't appear to be working for me, and I feel like I'm taking more and more of the medication, and my headaches are not getting any better. And I just want to know what else can I do.
Okay. Well, I'm not totally sure what's going on yet, but one thing we do know with migraines is that over time, they can be caused by an abnormal stress response of your body. So over time, your body gets worse and worse at shutting down that stress response so that even little things that wouldn't have bothered you before, like overdoing it, overcommitting to things, worrying about little things, even little things like that, turn that stress response on and cause migraine headaches.
Okay.
So one of the most important things people with migraines can do is learn to retrain that body stress response so that you can more successfully respond to stress.
Wow, it seems like stress is like the major thing. I just want to know why me. You know, I mean, people deal with stress every day.
Yeah.
And they don't have the migraines that I have. I mean.
And you're totally right, and that's very frustrating for a lot of people, because why do some people get really stressed and don't have headaches, and why do some people have just a tiny bit of stress and get a horrible migraine headache?
Right.
So one of the things I think that could help is to practice stress reduction techniques. And kind of retraining your body to respond to stress. There's actually a lot of good research and evidence that shows that if you can practice some of these techniques, you can reduce your headaches by as much as half.
Wow, that's good.
Yeah. So tell me what you're usually thinking when a headache comes on.
I'm thinking out loud. Like, I think, wow, I'm getting a headache, I'm getting a migraine. And, I really don't want to take my medicine, but I have to, just to ease the pain. And sometimes it just doesn't work. So I'm just thinking, what else can I do to get rid of my migraines?
Okay. Would you be willing to try something with me right now?
I'm all for trying something to ease a migraine.
Okay. Well, what I'll have you do is you get comfortable in your chair. And I'm going to have you put one hand on your chest and one on your belly.
Okay.
And I'm going to have you close your eyes and just focus on your breathing.
Okay.
And I want you to be taking such deep breaths that even the hand on your belly goes out when you breathe. So you're getting a lot of air into the bottoms of your lungs. Okay?
Yes, ma'am.
And so you just get comfortable and you focus on your breathing and just thinking about air moving in and out. All right. And now I want you to imagine that sometime in the future you're getting ready to have a migraine headache. All right? And as you feel that headache starting to come on, I want you to imagine thinking to yourself, I can manage this headache, and I can control whether my body is stressed or relaxed, and I can control how bad this headache can be. You able to imagine that?
Yes.
Okay. So now I want you to try imagining the pain of your headache as a big red ball. All right? And imagine that you reach out and you start squeezing that big red ball and start making it smaller and smaller. And as it gets smaller, you're feeling more and more relaxed. Okay? So keep breathing and just focusing on making that ball as small as it can possibly get. And as it keeps getting smaller, so does your pain. And I want you to get to the point where that ball is as small as a tennis ball.
Okay.
All right, are you there?
Yes.
Awesome. Now imagine throwing that tennis ball away. And when you're ready, you open your eyes. Okay. How was that?
It was great. I was surprised of how much control I had once I focused in on my migraine.
Awesome. And that is exactly the point of this activity, is to help you have some techniques to manage your migraines yourself and to help you feel like you have some control over your migraine pain and your stress. So a lot of it is retraining your body and your brain from thinking, gosh, I'm getting a headache, there's nothing I can do about it, I have no control over this, to, you know what, I can do something about this. I have control over how bad my headache is. I have some control over how much stress I'm under and how I respond to it. Okay? The other important thing is that you practice doing this, right? So practice makes perfect. And every day, at least twice a day, I would love it if you could practice this technique at least twice a day. And focus on your breathing and imagining that big red ball and your pain and your headaches just getting smaller and smaller.
Sure, I'll give it a try. I will.
Awesome. One of the other things that I think would help is something called a headache diary. Have you ever used one of those?
Nope.
Okay. So what it is, I actually have a sample right here. What you would do is, just like you would in a normal diary where you kind of write about things that happened to you during the day, yours is going to focus on your headaches. So when you get one, you're going to write down how bad it was on a scale of 1 to 10, when it came on, what you were doing when your headache came on, when you took your medicines and how much, okay? As much detail as you can put in there.
Okay.
And the point of this is so that it helps make some of these patterns of your headaches and triggers more obvious to us so we can help you manage them.
Sounds like a lot of work.
It is a lot of work, but if we can get your number of headaches down and how bad your headaches are, if we can decrease that too, do you think it's worth it?
I think it's worth it. I think it will be worth it. Anything to help with migraines.
I agree with you. So if you can do this headache diary for the next 2 weeks and practice that stress reduction technique twice a day for these next 2 weeks, I think we'll make some big strides. And then what we'll do is we'll follow up at an appointment. We'll go through your headache diary, talk about how your stress reducing activities are going, and check on your progress.
Okay, I think I can do that.
Okay, awesome.
All right.
Do you have any questions?
I think I can follow through and see you in 2 weeks.
Okay, that sounds like a plan, and
All
I'll
right.
see you in 2 weeks.
Thank you, Dr. Watson.
You're welcome.
All
It's
right.
good to see you.
Good to see you too.